if we look at the paid care sector or the supply side of things, we also have to consider how workers have been affected by the pandemic. I've already mentioned that salaries in this sector tend to be very low. Salaries of childcare workers, for instance, in 2015, they averaged a little over 24K, which is much lower than the average of all other workers. And they did not have access to protections like paid sick leave or other benefits, even though they are the workers who are helping to raise and develop our future generations. And we also saw that care workers in the health sector, which includes those in long-term care and community care, actually represented 20% of all COVID-19 infections in Canada. And this is double the global healthcare infection rate. So again, we saw many workers having to work in multiple jobs and in different locations, and they didn't have access to they didn't have economic security or access to paid sick leave. So it was necessary to work in those multiple jobs, and that in turn could have contributed to the spread of COVID. And we also have to consider that visible minorities and racialized folks are disproportionately represented in such care work roles. For example, representing 33% of nurse aides, orderlies, and patient service associates, and 40% of personal support workers. So it really came as no surprise that we were seeing COVID at 2 times higher rates in neighborhoods with a higher visible minority population. So it's really important to see how the vulnerabilities that were created among paid care workers really contributed to a vulnerability for our society as a whole.